Hello, my name is Inês Nunes da Cunha and I am the FIP Practice Development and Transformation Manager. Welcome to this CPD Bite about the Chronic Obstructive Pulmonary Disease Pharmacy Toolkit. Before we dive into the main content, let's take a moment to go through the learning objectives of this video. By the end of the session, you should be able to describe the global burden of COPD, chronic obstructive pulmonary diseases, and its risk factors. Recognize the critical role that pharmacists can play in the early intervention of COPD. Identify opportunities to raise awareness and support screening of COPD, particularly among at-risk groups, and understand how to integrate the COPD Pharmacy Toolkit into practice. This video provides a brief overview of COPD, its burden, risk factors, and links to other chronic diseases. Then, we will highlight the important role pharmacists can play in supporting people with COPD. Finally, I will introduce the COPD Pharmacy Toolkit, a practical resource developed to support pharmacists in this area. Chronic obstructive pulmonary diseases is a chronic progressive disease characterized by the obstruction of airflow in the respiratory system that results in breathing difficulties. It's sometimes called emphysema or chronic bronchitis. The most common symptoms of COPD are difficulty breathing, chronic cough, and feeling tired. COPD symptoms can get worse quickly. These are called flare-ups. This usually lasts for a few days and often required additional medicine. Tobacco use and air pollution are the most common causes of COPD. People with COPD are at higher risk of other health problems. COPD is not curable, but symptoms can improve if one avoids tobacco use and exposure to air pollution and get vaccines to prevent infections. People with COPD also have a higher risk for other health problems such as lung infections like flu or pneumonia, lung cancer, heart problems, depression, and anxiety. Common symptoms of COPD developed from midlife onwards. As COPD progresses, people find it more difficult to carry out their normal daily activities, often due to breathlessness. COPD is a major global health challenge, affecting nearly 392 million people worldwide. It is the fourth leading cause of death, responsible for 3.5 million deaths in 2021, which accounts for around 5% of all global deaths. COPD is also one of the leading causes of hospital admissions around the world. Importantly, patients with COPD often die from both respiratory and non-respiratory causes, including cardiovascular-related conditions, highlighting the need for comprehensive care. COPD is often interconnected with comorbidities such as cardiovascular diseases, depression, and lung cancer. Some comorbidities may arise independently of COPD, be causally related either through shared risk or shared pathophysiology, and may be a complications of COPD. So, equal attention should be paid to COPD and comorbidities. Comorbidities conditions must be considered and addressed as they have a major impact on health status and survival and can cause the same symptoms as COPD. Some of the patients with COPD may not yet fully appreciate the seriousness of their disease, but pharmacists can play a vital role in improving patients' knowledge about COPD and the possible consequence of not managing their disease. By understanding the risk factors and symptoms, patients can take proactive steps to manage their disease. Pharmacists can improve patients' knowledge of COPD, for example, by providing easy-to-read, accurate, and up-to-date COPD educational materials that focus on questions such as what are common COPD risk factors, what risks are associated with COPD, or how can COPD affect daily life. Also, pharmacists can explain key terms and tests that a patient may encounter using patient-friendly and accessible language, including flare-ups instead of exacerbation, or lung function tests instead of spirometry. Also, pharmacists can educate on the impact of COPD can have on daily activities and quality of life, and guide patients to primary care services as needed. To support pharmacists in managing COPD, the COPD Pharmacy Toolkit has been developed to help community pharmacy teams start the COPD conversation and make their moments spent with COPD patients matter. The COPD Pharmacy Toolkit has been designed to enhance patient interactions and minimize the burden on workload and workflow in community pharmacies. This toolkit supports community pharmacy teams in effectively identifying patients at risk and providing motivational counseling to empower those who would benefit from COPD assessment and management. You can access to the COPD Pharmacy Toolkit via the FIP NCD's microsite. Simply go to the main NCD areas, select chronic respiratory diseases, and then click on Toolkit. The COPD Pharmacy Toolkit was designed to motivate and support community pharmacy teams in establishing or enhancing a pharmacy-based program for the assessment and management of COPD. Its 4 core elements aim to upskill pharmacy teams on the value of a standardized approach to COPD, integrated this into the pharmacy workflow, and promote collaboration with prescribers to improve patient care. The first element is the COPD Pharmacy e-learning module, a foundational training module that uses a case-based approach to build core knowledge about COPD. The second element is the COPD assessment tool. This is a conversation-based tool designed for pharmacists and pharmacy team members to support patient counseling. It helps guide discussions around COPD risk, screening options, and how better manage the disease. The third element is the COPD Pharmacy Patient Information Leaflet. This is a printed handout to be shared by a pharmacist or pharmacy team member with the patient that can be used to summarize the pharmacist-patient interaction and provide supplemental information. The fourth element is the COPD Pharmacy Primary Care Referral Letter. This is a personalized letter that can be sent by pharmacists to the patient's primary care physician. It explains why the pharmacy is reaching out and outlines how both professionals can collaborate to support the patient's COPD management. I will now provide a more detailed overview of each element within the COPD toolkit so you can see how they work in practice and how they can be applied in your pharmacy setting. The COPD learning module is a self-study module that is recommended to be completed by all pharmacy staff who will be participating and helping to deliver the COPD Pharmacy Toolkit program. This module was designed to enhance the pharmacist's knowledge on COPD and the pharmacist's role in helping patients achieve better health outcomes over the course of their disease journey. In this module, you will find several chapters with content to help you better understand this disease and its comorbidities, how to assess and manage COPD and its exacerbations, and the role of the pharmacist in COPD care. You will also find a case study, learning checkpoints, and a glossary of terms. The assessment tool was 2 distinct pages: the Development Risk Assessment Tool and the Exacerbation Risk Assessment Tool. The Development Risk Assessment Tool was designed for pharmacists to help them provide a standardized patient-pharmacist conversation flow to support identification of those who may be at risk of developing COPD. Counseling and education are focused on risk factors for the development of COPD, importance of reporting symptoms to avoid prompt diagnosis, and managing COPD risk. You will also find conversation triggers for patient consultation about the risk of developing COPD, suggested counseling points for at-risk patients, and a reminder about the importance of reporting symptoms to facilitate early diagnosis and management of COPD risks. The exacerbation risk assessment tool was designed for pharmacists to help them provide a standardized patient-pharmacy conversation flow to support the monitoring and assessment of COPD symptoms. Reducing the risk for disease progression is critical. Using this tool to monitor change in COPD symptoms may help minimize the negative impact of COPD exacerbations and reduce the risk of subsequent events. The exacerbation risk assessment tool includes conversation triggers, an exacerbation assessment flow, and a flare-up checklist to help the identification of COPD exacerbation in the past year. The assessment tool was being designed to streamline the patient engagement experience so the COPD services can be easily integrated into everyday pharmacy practice. It also reinforces pharmacists' behavior and habituates their role as interventionists in COPD management. The assessment tool takes about 5 to 10 minutes to complete with each patient, and we recommend that you offer the patient a private place to sit and talk. The patient pharmacist conversation record is a leaflet for patients that can be used to summarize the pharmacist-patient interaction and provide supplemental information, as I mentioned before, and it allows the patient to review important information provided by the pharmacists about their risk of developing COPD or the risk of worsening symptoms for those already diagnosed with COPD. And includes information such as what is COPD, why are patients at risk of COPD or at risk of exacerbations, how to report symptoms, and what can patients do to reduce the risk of COPD or COPD flare-ups. A pharmacist should fill in and print the patient information leaflet on demand to share with patients during or post-assessment. This tool will take less than 3 minutes to print and share with the patient. And finally, we have the COPD Pharmacy Primary Care Referral Letter. That is a personalized letter to be sent by pharmacists to the patient's primary care physician that explains why the pharmacy is reaching out and how to partner to support the patients with COPD. This is a document with 4 pages and was 4 key sections. An overview of the purpose of the letter addressed to the prescriber, a risk factor summary checklist, and actions taken by the pharmacy checklist, and also a recommended assessment and management checklist. The referral letter has been designed to simplify the documentation and referral process so the pharmacist can quickly capture relevant information and recommendations to support further assessment of the patient and to help build a collaborative relationship. The letter can be printed and mailed or converted to a PDF and emailed to the prescriber. An infographic was also developed. This infographic is a one-page digital visual aid that serves as a quick reference guide on where, when, and why to use the COPD Pharmacy Toolkit in pharmacy practice, with quick links to the toolkit's practice resources. In summary, this toolkit will help you to recognize and identify patients at risk of COPD or COPD exacerbations, to start a conversation and take action, and also to collaborate with primary care. In conclusion, pharmacists, as one of the most accessible and knowledgeable primary care providers, are ideal placed to become key allies in the global battle against COPD. And there are multiple opportunities within the pharmacy to support symptom assessment and medication optimization. FIP publications in the field of chronic respiratory diseases include Chronic Respiratory Diseases Handbook for Pharmacists and the Chronic Respiratory Diseases Knowledge and Skills Guide. These resources outline the knowledge and skills pharmacists need to deliver effective services for chronic respiratory diseases and serve as a valuable complement to the COPD Pharmacy Toolkit. Both publications can be found on the NCD's microsite. Since tobacco use is a major risk factor for COPD, FIP also offers several publications on tobacco cessation, including a handbook for pharmacists and the Knowledge and Skills Guide. All these publications and resources are available on the FIP NCD's microsite. I hope this video was helped you better understand the COPD Pharmacy Toolkit and how it can support your practice. Thank you for watching.